Ms. Benoit, my name is Danielle Bailey. I'm a student physical therapist, and I will be performing a couple of clinical tests involving your sensation today.
Okay.
The first test is called kinesthesia. This is where I will move your leg in a couple of different directions, either up, down, in, or out. I'll go joint by joint, starting from your knee down to your toe. So let's practice a couple of these.
Up, down, in, out.
Good. At this point, go ahead and close your eyes. And again, tell me if the direction is up, down, in, or out.
Up, in, out, down. Up, in, out, down, down.
Good. Go ahead and open your eyes. I will move on to the other leg and we will perform the same test. Go ahead and close them.
Up, in, out, up, down. Up, in, out, down.
Good. Go ahead and open your eyes. Kinesthesia awareness is transmitted through the DCML, dorsal column medial lemniscus tract, via 3 neurons. The first order neuron involves the receptors of the periphery, including the Merkel cells, which then travel through the body to the dorsal root ganglion and the fasciculus gracilis, which is the more medial section of the dorsal column. The proximal axon of the first order neuron then synapses with the second order neuron and the nucleus gracilis, which is located in the lower medulla. At this point it decussates, where the dorsal column then leads into the medial lemniscus. And the second order neuron will then synapse with the third order neuron and the VPL, the ventral posterior lateral nucleus, and then which will then travel to the cortex and then terminate in the primary somatosensory cortex for more medially due to the lower extremities. The second test that we are going to do today is called discriminative pain. I will use a pencil eraser and tip to demonstrate sharp and dull on your medial nerve area. Go ahead, let me see your hand, please. So this is going to be dull. This is going to be sharp. Let's practice these with your eyes open. What is this?
Dull.
And this?
Sharp.
Good. Go ahead and close your eyes, and I will move this around your hand. Let me know if it is sharp or dull.
Dull. Sharp. Sharp. Dull. Sharp.
I'm going to turn your hand over.
Sharp. Dull.
Good. Go ahead and open your eyes. I will do the same thing on the other arm. So go ahead and close your eyes for me.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp.
Good. Go ahead and open your eyes. Discriminative pain is transmitted through the anterolateral column, more specifically the spinothalamic tract, via 3 neurons. The first order neuron involves receptors in the periphery, mainly the free nerve endings, which then travel ipsilaterally to the dorsal root ganglion and the dorsal horn on the lamina 1, 2, or 5 of the spinal cord. The first order neuron then synapses with the second order neuron and the cell body of the dorsal horn. At this point it will decussate, cross over, immediately at the level of the spinal cord. At this point, the axons will then travel up laterally through the anterolateral system, all the way up through the spinal cord and the brainstem, up to the VPL, the ventral posterior lateral thalamus, nucleus of the thalamus. At this point, the second order neuron will synapse with the third order neuron and the cell body of the VPL, ventral posterior lateral nucleus of the thalamus, and will then travel up to the primary somatosensory cortex. That is the end of our testing for today.